What does upper eyelid blepharoplasty do to the brows? Now, the real simple answer is that upper eyelid blepharoplasty encourages the brows to return back to their normal position. And really, the question that we should be asking ourselves is, what does excess upper eyelid skin, a medical term for that is dermatokinesis. So what is excess upper eyelid skin doing to our brows? Now, when we have excess skin to the upper eyelid, and that's between the brow and the lash line, this little bit of skin here, when that becomes more swollen and it drags out and it covers over the eyes, you can have an instinctive reaction without even realizing to raise your brows. And this happens slowly over years. And as a result, your eyebrows can go higher and higher as your brain naturally encourages you to activate the muscles in the forehead to raise the brows so that that skin that's covering or blocking your vision is moved out of the way so that you can see clearly. Typically, people report having higher brows, and also they may have frown lines because the muscles in the forehead are constantly activated to move that skin away. Now, once the blepharoplasty to the upper eyelids takes place and that extra overhang of skin is no longer there, what you can get is your brows coming back to the normal resting position. And that's why if you look online or if you speak to people, they may say, oh, after they had their blepharoplasty surgery to their upper eyelids, they found that the brows dropped. But really, they didn't drop. What they did is they returned back to that normal resting position, and probably their frown lines on the forehead also decreased. Now, if you are interested in maintaining a higher brow position, it's important to identify this to your oculoplastic surgeon, and it's also important for them to assess you to see if there is brow overaction so that they can advise you if you are at risk of having brow drop if that's not what you're wanting. And then they can discuss the options, whether it is to do nothing or to consider doing surgery to the brow via a browpexy or a brow lift, whatever may be suitable for you. But have that assessed and really remember that it's the excess skin that causes the brows to lift and not necessarily the surgery in itself that lowers the brows. I hope that's useful.